Hello, welcome to Chapter 13. This is all about the brain. We're going to go through and we're close to the end of the semester, so I have cut some materials out from this chapter. But we're going to go through the basic regions of the brain, brain formation, and we're going to talk about some disorders associated with the brain as well. So the brain itself is not a very large organ. It has a huge responsibility. Basically sends every signal out so that you can do the things you do. Every conscious thought, every conscious activity that you do is from your brain. Subconscious activities like your heart beating, digestion, urination, so urination, I should say bladder filling maybe, all occur because your brain is telling everything to work. And it's only about 1.3 to 1.4 kilograms, which is a really, really lightweight. Because I'm not all up on my kilograms to pounds and everything, I went and checked, and that the brain is only about 3 pounds, so super light compared to other organs of the body. The outer surface of the brain is very bumpy, so there's a lot of folds and like kind of hills and folds all around it. The grooves are called the gyri, and the really deep folds are called fissures. And, I always think when I'm talking to people and you're learning something, I always say, hey, you just got another wrinkle, because our brain gets more wrinkly as we age. As we learn, we get more wrinkles. Our brain folds in on itself to help in increasing the size so that it can make more connections, neural connections. There are 4 basic regions to the brain. There's the cerebrum, cerebellum, diencephalon, and brainstem. And then we have 12 cranial nerves, 12 pairs of cranial nerves that come off of the brain. I mentioned these already. The folds are the gyri, they're the little bumps. The depressions are sulci, or the real deep depressions are called fissures. Okay. So the brain does have some, or there are some disorders associated directly with the brain. Any traumatic brain injury can cause you to lose the ability to do certain functions. It could cause you to lose memories, or it could, and these could be lasting effects, or they could just be temporary effects, depending on what's going on with your body. And so, and a traumatic brain injury is just any brain damage occurring as a result of trauma. So you're in a car accident, you get whiplash, your brain moves, hits the cranial bone anteriorly and then posteriorly. That could cause bruising on the brain. Getting hit in football, if you've ever played football, getting hit really hard, that could, and you fall down and you hit your head, or someone tackles you and hits you, that can cause trauma to your brain. If you just are playing basketball, if you're dancing, anything, anytime you hit your head hard, damage to the brain. One of the most common types of damage is called a concussion. Concussion is associated with a temporary loss of consciousness. So getting hit on the head doesn't just give you a concussion. Getting hit on the head is a severe or hard hit on the head, be it by whiplash or any other thing, can cause a concussion, and it's associated with loss of consciousness. So you basically pass out, you And when you wake up, you'll have certain symptoms of or signs of the disorder. So you're going to have headache. You might have slight amnesia. Typically, you're tired, and usually they'll tell you to not go to sleep. They want to make sure that you are with it for a while. Usually, this is temporary, which means any type of loss that you have will come back. But if you have multiple concussions in a row, it could affect your ability to learn or affect your ability to function normally. A contusion then is severe bruising on the brain associated with a severe blow. And with a contusion, typically you are unconscious for multiple minutes. So here you're seeing someone hit something, so maybe they are in a car again and their head whips forward and hits the dashboard and then hits backwards. That could cause a contusion. Contusions typically are associated with swelling on the brain, which then is going to lead to other problems, because if you have swelling on the brain, since the brain doesn't have really anywhere else to go, that swelling is going to put pressure on the brain tissue and can actually kill tissue. So here we have a brain that had severe contusion. And a contusion oftentimes will lead to inabilities, amnesia, or confusion. You may have to learn to do certain things once you are over the impact or over the disorder or over the injury. Once the injury has been treated and you're back, you're no longer have the swelling on the brain, you may have to learn how to say words or feed yourself, stuff like that. So the brain starts to develop around week 3. And so you don't actually have a brain at that time. What you have is a groove called the neural groove that will eventually form the brain and spinal cord. Nervous system is formed from the ectoderm. You remember this hopefully from chapter 5. And the process is called neurulation. And so you start with just the ectoderm folding in, forming this neural groove. That neural groove will eventually become the neural tube. And that neural tube will eventually form the brain and the spinal cord. And so think about the time we start developing our brain around week 3, gestation. So this is right around the time that, so we've just formed the embryo, and the embryo now is forming the organ systems. And so the first organ system, the brain is developing. So any type of chemical agent or any type of damaging materials that mom takes into her system can affect brain and spinal cord development, which can lead to a lot of different problems. And usually mom doesn't even know she's pregnant at week 3. She hasn't missed a period. She doesn't have a lot of signs or symptoms of pregnancy, which is why typically, if you're having unprotected sex, then you want to be, thinking about, okay, we had unprotected sex last Wednesday. It's been 2 weeks since my period, so maybe I should hold off on alcohol or any other drug items until I know for sure that I'm not pregnant. And so does that make sense? Because otherwise you can actually cause damage without meaning to, and that would be horrible. So neural tube defects that can occur. Um, on this is talking about, so there are different disorders. The figure here is showing anencephaly. Most deformities are associated with inappropriate nutrition or damaging chemicals. Damaging chemicals are anything that can cause, well, organs not to develop properly. So alcohol, smoking, cocaine, all of those things. Um, some of the disorders are not as serious as others. Typically, if you find out you're pregnant, you start on prenatal vitamins right away. If you're at the age where you could get pregnant, you should be taking prenatal vitamins. If you are having unprotected sex, just to be safe, it's always a good idea. The first disorder then is anencephaly. This is a severe disorder. It's very rare. That does not mean it doesn't occur. It does occur. In my life, I've known two people who have dealt with anencephaly. And so, I mean, as rare as it is, it's something that does occur. Anencephaly is being born without the cranial bones, without the brain, or so it could be you could have just no brain, cranial bones at all. You could have only a partial brain and partial cranium bones. What typically happens though is when you are born, if you are alive because you have partial brain, um, you don't live very long. You may live to be um, at the most, I can't tell you because I haven't looked it up lately, but you typically don't live. It's usually hours to days. There are some individuals that have lived for, up to like a year or two. The problem is if you have a region of your brain that's missing, then you can't control the homeostatic mechanisms that that region of the brain typically controls. If you have, say if you had no cerebrum, you'd have no consciousness. But if you have the cerebrum, but say part of the diencephalon is gone, you wouldn't have potentially, I'm making this up, but you wouldn't be able to relay messages to the cerebrum, so you wouldn't be able to control movements effectively to move your body the way it's supposed to move. Specifically, think about touching something hot, moving your hand away. You wouldn't be able to control sweating, temperature, thirst, hunger. Those things would not be able to be controlled. This is a rare disorder, and there's no, like, you can be doing everything right, and this disorder can occur. So it's not like if this disorder occurs, that the parent is always at fault. This is just, it sometimes happens randomly. It just is. Spina bifida, much more common disorder, is failure of the spinal cord, not spinal cord, I'm sorry, of the vertebrae to close properly. And so the spinal cord, the nerves in the spinal cord and the spinal fluid actually pool outside of the spinal cord area, can cause paralysis because you're putting a lot of pressure on the nerves and everything. It can cause other problems. So here is a child that has spina bifida cystica. This is a severe form of spina bifida. Oftentimes, spina bifida cystica is associated with other disorders as well. So anencephaly would be an example of a disorder that could be associated with spina bifida. You could have hydrocephalus associated with spina bifida, cystica. With this, the you don't have that vertebral um, arch forming, and so you don't have the not transverse, but the oh, why can't I think of the word? Um, you don't have the well, I'll just say the vertebral arch doesn't form, and because of that, you have this pooling of fluid out in the epidermal or dermal epidermal regions, and this can cause paralysis and other problems. Typically, treatment would be to have surgery done to fix the bone, but sometimes surgery can actually lead to life paralysis, where you damage the nerves. If they do fix the bone, so like here, and then the nerves are all inside, depending on the size of the cyst, this can occur. You can live a totally normal life as well. So it really will depend on how large the cyst is and where the cyst is located, what nerves are there, if the doctor's going to do surgery. The more common type of spina bifida is called spina bifida occulta. And so this is where you do have that vertebral arch. It just doesn't form 100%. And so you still have the nerves enclosed almost 100%ly, and the fluid stays there. But there's always that potential for some pooling of spinal fluid. Oftentimes, one of the signs for spina bifida occulta is a tuft of hair at the region. That doesn't always occur. Sometimes there's no sign that you have this disorder, and so you may not find out until you're an adult. The example I use is my own son. He was my oldest, who is 24 now. He was born, he had spina bifida occulta. I did not know until he was 20 years old and went to a chiropractor and had a bone scan done. And this chiropractor was looking and said, "Did you know you have spina bifida?" And he was like, "No." And I was like, "No." And it was kind of weird. One of the reasons spina bifida occurs is due to not taking enough folate in. And so you get folate from most cereals, in your prenatal vitamin, you get folate. So my son was like, "You didn't take enough and you caused me this disease." We were joking though, because he's not hurt. So. All right, so let's look at the structures that protect the brain and the spinal cord. Um, we've already talked about some of these structures, so you know about the cranial bones that are very protective. You know about the skin that also provides protection, first line of defense. But some things you don't know about that we haven't talked a lot about are meninges that cover the brain and that help in producing and moving cerebrospinal fluid around. So these are connective tissue membranes. Cerebrospinal fluid itself, which we talked a little bit about in Chapter 12 when I talked about CSF. And then the blood-brain barrier, which I also talked briefly about when I talked about the neuroglial cells in Chapter 12. So since you know about the bone and you know about the skin, we're going to go to the meninges. The meninges are 3 layers of connective tissue, and these separate the brain from the cranial cavity. They surround the brain And between the meninges, there is cerebrospinal fluid that's constantly circulating that helps to nourish the brain and keep the brain buoyant. So from the deepest to the most superficial, we have the pia mater, the arachnoid matter, and the dura mater. So you've heard of epidurals. Epidural is just before the dura mater. So an epidural that is given for a pregnancy is an injection before the dura mater of the spinal cord. An epidural hematoma is blood pooling outside of the brain, but inside the cranial bone. Typically, this is going to occur because of a severe blow to the head that causes maybe cracking of the bone that can cause bleeding on the brain. The treatment, they're going to, because it's your brain and the cranial bones don't allow for any movement, they have to relieve the pressure before the brain itself gets compressed so much that the tissue starts dying. So they're going to use a drill into through the cranial bone to relieve the pressure. And then they'll treat the disorder by fixing wherever is bleeding. And hopefully they'll be able to, you'll not have any loss of brain function. So there's an actual, or not an actual, but there's another figure showing an epidermal hematoma and what it would look like on a CT scan. Another one is the subdural hematoma. So this is usually bleeding not associated with the cranial bones always. This could be bleeding from the brain itself. So artery ruptures in the brain causing bleeding deep to the dura mater. And so now you have bleeding, but it's from the brain itself. So this would be a little bit more severe of a problem. Again, they're going to have to remove the pressure, but then they're going to have to go in and actually try to figure out what is causing the bleeding. The last disorder associated with the brain is meningitis, so inflammation of the meninges. Not last disorder of the brain, but of the meninges. This is usually associated with either a viral or bacterial infection. So here are some different bacteria that cause meningitis, viruses that can cause meningitis. There are others. These are just some examples. Bacterial meningitis is much easier to treat and not as detrimental. Viral meningitis is more, so do I want to say it's more severe? It's not as easy to treat, and because of that, it can be harder to deal with. Well, obviously. With meningitis, because you have inflammation of the meninges, it can also put pressure on the brain. You need to have it checked very early on. You need to be checked for this disorder. So if you ever have, fever, vomiting, and a stiff neck, those are signs that you might have meningitis. The fever and vomiting can be a lot of things, but the stiff neck is typically what you look at for the if you have meningitis. This can result in death if not treated. And what else can I say? They do have vaccines now that you need to take before going off to universities, because meningitis is such a common disorder. So, like I said, viral meningitis more common and not as easy to treat. Bacterial meningitis oftentimes can have more severe symptoms, but is much easier to treat. So we're going to stop here so that I can put this lecture up, and then we're going to get into the ventricles of the brain next in the next chapter or in the next lecture, okay? Bye.